Unit 23, Meeting Resident and Family Needs, Admission, Transfer, and Discharge. Feelings of the residents. The residents may have to make emotional adjustments before entering a facility and may experience any or all of the following: fear, uncertainty, anger, loss of health, loss of mobility, their independence, family, friends, pets, and plants. Remember, a long-term care facility is a resident's home. It is essential for the nurse aide to remember and make the resident feel as comfortable as possible, even if the resident's culture or lifestyle is different from your own. We've talked about this in other units about how they might feel. Perspective quiz, you will find this worksheet under content, or you should have a handout that I provided on the very first day of class that you will complete and turn into me by the due date. So on the perspective quiz, your house has been sold and you need to live with your sister and her family for about 6 months or more. You need to work out some problems. Perhaps you will even be staying with them permanently. You don't know for sure. You will share a room with your niece. Your space is 6 feet by 12 feet long. There's a single bed, a chest of drawers, and a soft chair that you can use. There is also a screen available for your privacy. You will need to decide what you will take with you. You can store anything you do not take, but you will not have access to any stored items until you move again. So, this is the worksheet, the first part of it that you'll be completing. Think of the space, 6 foot by 12 foot. All 6 items must fit into your small room or in your half of the closet, which is about 5 foot by 3 foot space. Name 6 things that you will take with you. 7 outfits of clothing count only as 1 item. You will complete this and turn it in by the due date. You will also complete this worksheet. During the first week, your niece, who is 5 years old, is looking at one of your treasured things and accidentally drops and breaks it. How do you feel? And it is now the second week. You still have not received any of your mail, which you had notified the post office to forward. You mention this to your sister, and she says offhandedly, "Oh, I did see some here yesterday. I don't know where it's at." Then she walks out of the room. What is your response? Personal belongings. Remember, in many ways, our homes are our personal museums. They house the souvenirs of our lives and the pictures of our families, the decorative items we like, the furnishings we have chosen. It can be very difficult to part with these things, even for a short time. Residents' rights recognize how important personal property is. By assuring that residents can bring belongings into the facility as space permits, unless doing so would infringe on the rights, health, or safety of other residents. You can probably understand why the resident's rights state that the resident has the right to privacy in written communications, including the right to send and promptly receive mail that is unopened. Admission. A variety of circumstances result in admission to an adult care home. Rehabilitation after a surgery or illness, so maybe they're only going to be there for a little while. Or the resident is unable to safely carry out activities of daily living because of situations like dementia and increasing disability. Or maybe the resident needs hospice services. Anticipate that the resident and family are dealing with a variety of emotions, including the stages or phases of grieving. As we discussed in prior chapters, anger, denial, anger, bargaining, depression, and acceptance are included in those stages of grieving. They may be acutely aware of losses experienced with aging and increasing disability, anxious and afraid of the unknown or loss of control, confused and unable to understand the environment. They may be angered. The resident may voice anger at family for adult care home placement. Family members may show anger towards each other. Guilt, the family may feel that they have failed as caregivers. And relief, the resident is in a safe environment. For residents who can get out of bed, you will measure height using a standing scale. And we went through that procedure in lab. So I'm not going to really cover much on this. Just identify yourself by name, identify the resident by name, wash your hands, explain the procedure to the resident. If they can stand, then obviously we're going to stand them being straight up and down on the scale, just like is shown here in this picture, and you'll measure them just like we did in lab. Assist during a mission, prepare a room or living space for the resident. Expect that the resident and family will bring personal items to make the environment more familiar. Have the room prepared before they get there, so it looks like you were anticipating them, that you're anxious for them to be there. Don't wait until they arrive and then turn the room down, the bed down, get the water. Have it all ready for when they arrive. Welcome the resident and the family and be courteous and friendly. Introduce yourself, give them your name and title. Create a good first impression. Show the resident the room, the bathroom, and how to use the call signal. Introduce the resident and family to a roommate if there is one. Assist the resident and family in making a list of valuables and clothing on inventory sheet and follow the procedure of the facility. Many times, even in like admissions to the hospital, we will take an inventory of their personal belongings. That way, if when they're discharged or they pass and the family comes to pick up their belongings, we can identify exactly what they had. So if something is missing, then we know that they actually had it there at the facility. Mark the belongings with the resident's name according to procedure. Show the resident and family around the facility or unit. Listen to the questions and concerns expressed by the resident and family. Observe and report anything that you feel needs to be reported to the nurse, and check on the resident frequently. Admitting a resident equipment may include admission paperwork, a checklist, and an inventory form. So basically, we're going to, again, introduce yourself, wash your hands, explain what you're doing, provide for the resident's privacy. If the family is present, ask them to step outside until the admission process is over. Show them where they can wait and let them know approximately how long the process will take. If part of the facility policy, do these things. Measure the resident's height and weight. Measure the resident's baseline vital signs. Baseline vital signs are initial values that can be compared to future measurements. Obtain a urine specimen if needed. Complete the paperwork. Take an inventory of the personal items. Help the resident put personal items away, and provide fresh water. Show the resident the room and the bathroom. Explain how to work the bed, the controls, and the call light. Show the resident the telephone, the lights, and the television controls. Introduce the resident to his roommate if there is one. Introduce other residents and staff. Make sure the resident is comfortable. Remove privacy measures. Bring the family back inside if they were outside. Place the call light within the resident's reach. Wash your hands and document the procedure using facility guidelines. Guidelines for admission. Nurse aide should remember these guidelines for admission. Prepare the room before the resident arrives, as I mentioned earlier. When the resident arrives, note the time and the resident's condition. Introduce yourself, giving your position. Address the resident by his formal name. Do not rush the admission process. Make sure the new resident feels welcome. Explain the daily operations in the facility. Offer a tour. Introduce the resident to everyone. Handle personal items with care. Honor the resident preferences when setting up the room. And observe the resident for any problems that are missed during the admission. So the standing and upright scale or bathroom scale. Identify yourself by name. Wash your hands. Explain the procedure to the resident. And basically, I'm not going to go on further than that. You always want to make sure the scales are zeroed, and then you'll end up getting their weight if they're able to stand. Make sure that they're not touching or holding anything or leaning against anything, because that will interfere with the weight measurement. If you can't get the weight, then let the nurse know. Using the standing scale, we demonstrated that during lab, so I will not go over this here. Assisting the resident and family during transfer. The resident moves to a different room or different unit within the facility. This also applies to a resident moving to a hospital. You want to decrease their anxiety by talking to them and letting them know what's going on and answer any questions that you can answer for them. We want to communicate what's going on. We want to be consistent between what the nurse is saying and what you're answering also, and use assistants using an inventory sheet to make sure that the belongings get sent with them, and we document what was sent with the patient where. Transfer guidelines. It is the resident's legal right to be informed of the transfers. The nurse should explain the details of the transfer, and you will pack the resident's belongings carefully. The residents must always be informed of any room or roommate change as well. So basically, the nurse will tell them what's going on, but then if you heard what the nurse says, you can reinforce that or reemphasize that with the patient if they ask. The resident may return to their home after rehabilitation or move to a different facility. Anticipate mixed feelings. Again, they could be denial, anger, bargaining, depression, acceptance. Answer the questions. Assist as you can, and notify housekeeping per policy upon their discharge. The nurse may discuss the following with the resident who is being discharged: doctor or physical therapy appointments, home or skilled nursing care, their medications that they're going to continue at home, ambulation instructions, medical equipment that's needed, medical transportation, restrictions on activities, spatial exercises, spatial dietary requirements, and community resources. When you discharge a resident, anticipate the need for a wheelchair, a cart for their personal belongings, making sure that they receive their discharge paperwork from the nurse and that the nurse has cleared them to leave. Make sure that you've went over the inventory list from the admission, and make sure that the resident has all their care items. Document the procedure using facility guidelines, including what time they discharged, how you transported them, if they went by wheelchair to a personal vehicle, if they went by a wheelchair to a wheelchair van, who was with the resident, the vital signs at discharge, and what items the resident took with them. So complete that inventory checklist. Exams. Nurse aides can help lessen the resident's fear and discomfort during exams. So when the physician's doing an exam, or the nurse is, you can be there to assist and to help decrease their anxiety. Inform the resident of what to expect as much as possible. Nurse aides should communicate to the residents why the exam positions are needed and how long the resident can expect to stay in the position. Nurse aides may need to gather the following equipment for the nurse or the doctor: a sphygmomanometer, stethoscope, alcohol wipes, flashlight, thermometer, tongue depressor, eye chart, and tuning forks. A reflex hammer, otoscope, ophthalmoscope, specimen containers, lubricant, special card to test for blood in the stool, a vaginal speculum, gloves, and a drape. Those items you'll learn as you get into your careers and into the fields what the different types of equipment are as they're needed. So we have some different types of positions that can be used for examinations that you need to be familiar with. One is the dorsal recumbent position. This is in which the body position in which a person is flat on their back with her knees flexed and her feet flat on the bed. Okay, so they're laying on their back, their knees are flexed up, and the feet are flat on the bed. The lithotomy position, the body position in which a person lies on their back with the hips at the edge of the exam table, the legs are flexed, and the feet are in padded stirrups. That would be for like a vaginal exam. And the knee chest position, the body position in which a person is lying on their abdomen with the knees pulled towards the abdomen and the legs separated. The arms are pulled up and flexed, and the head is turned to one side. So these are examples of the dorsal recumbent position in which the person is lying flat on their back, their knees are elevated, and the feet are flat on the bed. The lithotomy position, again, they're flat on their back, their knees are elevated, but the legs are off the bed and the feet are in the stirrups. And then the knee chest position where they're lying basically on their stomach with their knees drawn all the way up and their arms flexed up under their head with the head turned to the side. Remember these guidelines for physical exams. Wash your hands before and after the exam. Ask the resident to urinate and collect the urine if needed. Provide privacy throughout, listen to and reassure the resident, follow directions, help the resident into the proper position, protect the resident from falling, and provide light to the examiner. Put the instrument in the proper places, take and label specimens, follow standard precautions, assist with vision screenings as ordered, help the resident get cleaned up, get dressed, and return to the room, dispose of trash and equipment, clean and store equipment, and take labeled specimens to the proper place. So practice questions. Which of the following is a reason that new residents may have trouble adjusting to life in a care facility? A, they will have more independence in a facility. B, their health is improving. C, they've had to leave their home. Or D, the other residents and staff are people they already know well. And 2, which of the following should a nursing assistant do during a resident's admission? A, the nurse aide should get the admission process completed as quickly as possible. The nurse aide should allow the resident to introduce himself to everyone in the facility. The nurse aide should explain how to work the call light and bed controls. Or the nurse aide should place the resident's personal items where the nurse aide feels best. 3, what is the nursing assistant's responsibility during an in-house transfer of the resident? A, the nurse aide decides that the resident must be transferred. B, the nurse aide must keep the fact that a transfer will occur a secret. C, the nurse aide should pack all of the resident's belongings. Or D, the nurse aide should tell the resident's roommate about the transfer. 4, when a resident is going to be discharged, the nurse aide should A, give the resident ambulation instructions from the doctor. B, be positive and assure the resident that he is ready for this change. C, give the resident his last medication. Or D, decide what or which dietary requirements the resident will need. 5, before weighing a resident, the scale should be balanced at A, 0, B, 5 pounds, C, the resident's last known weight, or D, -2 pounds to account for clothing. 6, during a physical exam, the nursing assistant can help a resident by A, avoiding a resident's questions if he asks why a position is needed. B, chatting with the doctor to pass time. C, telling the resident funny stories. Or D, covering the resident and not exposing him to more than is necessary. 7, baseline vitals are A, initial values that can be compared to future measurements. B, normal ranges for vital signs. C, vital signs that are out of the normal range. Or D, changes in vital signs from one measurement to another. 8, how will a nursing assistant measure the height of a resident who cannot get out of bed? The nurse aide will use a scale. The nurse aide will use a tape measure. The nurse aide will estimate the height by looking at the resident, or you will not be able to measure the height. 9, in which position is the resident placed for examination of the breast, chest, and abdomen? The knee-chest position, the lithotomy position, the dorsal recumbent position, or the Trendelenburg position. And 10, why might a resident need emotional support during a physical examination? A, the residents are always frightened of exams. B, the doctors are not very sensitive to their emotions. C, the resident has probably never had a physical exam before. Or D, the resident may fear what the examiner will find. You will take those 10 questions and turn those in before their due date that I have provided. So again, you will need to just go back a little bit in this PowerPoint presentation and answer all 10 of those questions, and again, turn in before their due date.